Hi, I'd like to share with you a scenario that's very familiar in the grocery store. I'm sure you've been there when you're getting ready to check out. The grocery stores have it strategically planned so that when you're checking out, they have all these gums and candies. They're all set up around you, and little children in the cart are like, "Mommy, Mommy, buy me gum," or they're pulling candy, various things in your cart, and you're saying no. And then finally, as a parent, you feel guilty and you give in and you say, "Okay, well, here's some sugarless gum. This is good for their teeth. I guess I'll buy this." Well, I want to share with you today some products that will prove if buying a certain type of gum, it is really beneficial for your children to chew it. Most people are not aware of what dental caries is. Today we call it caries, but to most of us it is known as a cavity. What we need to understand is that cavities are definitely an infectious disease, and it does cause tooth decay. When you have tooth decay, you have pain in your mouth, and if it's not treated, it can actually go into your bloodstream and cause death. I say this because once it reaches into your blood, it's an infection, and if it's not treated, you can have definite physical complications. Tooth decay is actually caused by bacteria. In our mouth, we have a normal pH balance of 7.1. When this pH drops below 5.5, the bacteria that's on our teeth begins to demineralize, and when it demineralizes, it starts to break down our teeth. Our teeth are mineral in nature. So our teeth are balancing back and forth between a process of demineralization and remineralization. The bacteria is what's causing the demineralization. Good oral hygiene is definitely important when you're dealing with your mouth and tooth decay. Our teeth have a definite anatomy. There's the enamel, and below the enamel is the dentin. When the demineralization starts to take process, you can see a white chalky area, and as this progresses, it also starts to put a brown spot on your teeth. When your dentist goes in and probes on your teeth, he finds these little soft spots, which indicates to him that you have dental caries. Dental caries also can be below the tooth surface, and that is why they use radiographs to see what is going on underneath the surface of your teeth. If you have a problem with bad breath or a foul taste in your mouth, this can also indicate that you have dental caries. Bacteria collects around the gum lines of your teeth, and when this bacteria collects there, sugar, when introduced into your mouth, forms an acid and starts wearing around at the dentin in your teeth. In dentistry today, we're all aware of brushing your teeth, and this is a Triumph toothbrush, which is a good product to use and to introduce your children to at a young age, which also has a little apparatus with it. This toothbrush will brush your teeth, and they recommend 2 minutes. In 2 minutes time, the toothbrush, it will divide your mouth into 4 quadrants. When it's done with the first quadrant, the toothbrush will actually perform a jerking motion, which will indicate that you need to move to the next quadrant. After the 4 quadrants are done, in this little display will be a smiley face indicating that you have brushed your teeth for the full amount required to have good dental oral hygiene. We're also aware that we're supposed to floss our teeth, and flossing is recommended 1 time a day to get out the particles in between our teeth. And we're also much aware of using a rinse or a mouthwash that will help to prevent the buildup of caries, put fluoride in our mouth. What I'd like to introduce you to is 2 products. One is called MI Paste. MI Paste was introduced into the market of dentistry in the year 2000. It was studied by Eric Reynolds in the University of Melbourne in Australia. Dr. Reynolds wanted to study the prevention of oral diseases in the mouth. Recaldent comes from a peptide in the milk protein called casein. It's the casein that's in the MI paste that binds to the surface of the teeth and actually makes the enamel to become harder and penetrates to the tooth surface. MI paste is only available from your healthcare profession. It comes in strawberry, melon, vanilla, mint, and tutti frutti. It's very easy to use. In the evening before you go to bed, you just open the cap and you can either put some on your fingertip or you can take a Q-tip, put it in your mouth, swish it around. You can swallow it because it has nothing that can harm you, and go to sleep. If you do not do this in the evening, then it is recommended you wait an hour before you eat or drink anything, because we want this to sit on your teeth and to help build up the enamel. The second thing is something that's called Recaldent. Recaldent is distinguished by this red and blue circle. And Recaldent is in gum, and it is good for your teeth. When chewing gum that has Recaldent, what it does, it reduces the plaque. It prevents you from having dry mouth, adds the saliva into your mouth, which fights to remineralize your teeth, and it will definitely cause you to have an enhanced effect of fluoride. Now you say, okay, Recaldent, what does that have to do with being in the grocery store and shopping with your children? Well, I'd like to let you know that if you purchase Trident gum, it looks like this, okay? You will see on the corner here, it has a little circle that says Recaldent. Okay, so you can be assured that when your child chews gum with Recaldent, he's not only chewing gum, but is helping to strengthen his teeth and also to strengthen his teeth and to fight against dental caries. So the next time that you're in the grocery store, remember, when your child starts grabbing, Mommy, Mommy, Daddy, I want this, and pulling gum off the shelves, that you can rest assured, if you pick a product like Trident White with Recaldent, that you will be helping to promote good dental oral health for your child. Please remember that all of these products are good for you, but do not take the place of visiting your dental professional and having good oral hygiene. You know, I think maybe Ben Franklin was onto something when he said, an ounce of prevention is worth a pound of cure. Wouldn't you like to see your child strengthen his teeth? Isn't that a form of prevention?